Okay, so internal medicine, emergency medicine, that's 3 years, right?
Those are 3 years.
What track did you choose, and how long is that track?
Yeah, so I'm going to physical medicine rehabilitation, which I'm going to break that down because a lot of people don't know what it is.
Yes.
It's a field that focuses on restoring function for people, often after a trauma. So there's a neuro-rehabilitation component of the field, which focuses on spinal cord injury and traumatic brain injury.
Yes.
That's more of my side.
Okay.
And it's not the acute, stabilization of the patient. It's not the neurosurgery. It's kind of after all of that. After all that, there's still a big gap between where they're coming out of the ICU and then going out into the community.
And trying to be functional. Going back to being a functional person in the community. And that's your focus.
So we bridge that gap. We're kind of helping people relearn to walk and talk and overseeing all their rehabilitation care. The field also includes the physical medicine component, which is more spine, sports medicine, pain. So that would be like sports injuries, spine injuries, the non-surgical part of those treatments.
Of course. So before we go on, I want to ask, so how long is that? How much residency? How much time are you?
So for that track, the education process is very, and training process is a little confusing.
It really is, and that's why I had to really get in the depths of that.
So certain residencies, you have to do 1 year of either a transitional year or preliminary year before you enter the residency.
Okay.
So for me, that's what I'm doing right now. I'm an internal medicine doctor right now for my 1 year.
So you have to do that transitional year.
Yeah, it's called a preliminary year for me. You could also do it as a transitional year where you rotate through like OB-GYN and pediatrics and surgery and medicine. Or you can do it as a focused year on internal medicine or surgery. And then you go into whatever other specialty. This is only for certain specialties that have this.
Of course.
So physical medicine and rehabilitation is one of those specialties that has a 1 year required preliminary or transitional year before then you enter the 3 additional years of training. And then after that, you can do a fellowship. So
you can. So the fellowship is a choice?
Yeah.
And is that a choice you're going to make?
Yes.
Okay. And what is the pros and why would someone choose to do a fellowship versus just jumping on it?
Yeah, so if you want to subspecialize, especially if you want to do clinical research, I think that having a fellowship is good. And if you want to work within a certain subspecialty, it just gives you further training within it.
Wow.
So for me, that would be traumatic brain injury. And it's only a 1 year fellowship.